Okay, this next section we're going to talk about is the upper extremity, the different motions that occur with the upper extremity, and then we're going to talk about the muscles that go with the motion of the upper extremity before we break down in different sections of the body. So a big, huge important part to understand about is the shoulder girdle. Pretty much you can't do anything in the upper body that doesn't involve the shoulder girdle. We've got our two main joints. You have what you call your ball and socket or your glenohumeral joint, which we see shown right here in this picture, all right? Then you have your other joint, your acromioclavicular joint, which we refer to as your AC joint many times, your acromion process, the end joint of your clavicle here where they meet, all right? You have a lot of space that occurs right here that looks like a lot of space, but you actually have quite a bit of tendon and ligament structures that occur right there. You're going to see a lot of what we call impingement syndrome, where when this humerus abducts out to the side right here, you'll see a lot of people have, as this humerus goes into abduction right here, this space right here will actually decrease because the bone will actually can glide and get irritated underneath there, where you have the supraspinatus tendon, and things like that I'm going to show you here in a second. But it's very important to understand. You see this acromion process right here, which it has a lot to do with your scapula, your shoulder blade. And if you can keep these joints nice and pulled and have an appropriate amount of space, you're going to have less likelihood of that. You're also going to have a better positioning in this ball and socket, and you're less likely to have rotator cuff injuries and this impingement syndrome. So it's easy to understand how the shoulder can be very vulnerable to injury, because we talk about you give up stability for mobility in terms of the shoulder. As we see earlier, we talked about, I said the 4 types of motion you need to be aware of was going to be elevation, retraction, protraction, and depression. All right, not necessarily in that order, but you see right here we've got elevation, which is elevating of your scapula, okay, your shoulder blade, and you can see the posterior section of that acromion process right there. You have depression, which is bringing it down, not just to the neutral position, but really beyond that, when you're actively using this trapezius and rhomboid muscles to pull it downward. Elevation, you're looking at from your axis of motion at the 0 degree point will elevate up to around 40 degrees and downwards about 10. So you're going to get a lot more motion in the upper trapezius, which you see a lot of people carry a lot of stress up in the upper portion of the trapezius. That's also why it's harder to understand that downward motion is also part of the importance of a properly strengthened shoulder girdle. That leads us into retraction, which is actually the pinching of the shoulder blades together, as opposed to protraction, which is the actually rotating the shoulder blades outward. We talked about earlier when I was saying you could example would be like a boxer throwing a punch. In order for me to do that, my shoulder blade is going to protract out away from my body. And so you can see in the top downward position, protraction, this being your reference point is 0 degrees. Retraction, you're going to go down backwards about 25 degrees. In protraction, you're going to get a little bit more active range of motion, which is also why it's so easy to get where we get in that forward motion, which gets us into bad posture a lot of times. It's very important to strengthen the retraction aspect, which helps with postural muscles. You're going to have upward rotation of the scapula. It's going to be upward and outward, and allowing the humerus to rotate around into reaching over the head. Okay, so you're going to see how the cross section here, or the posterior section, excuse me, shows the 30-degree angle, and then you're taking it over when the humerus takes over and continues on to rotate all the way above the head, an upward rotation. This is a side profile view of your different, once again referencing your anatomical position. If I was going to stand like this, I got my palms at my sides, but a profile view, as you see, referencing the anatomical position being your 0 degree reference point. Hyperextension, meaning extending that humerus, your arm bone beyond the anatomical position behind your body, is hyperextension. It's not necessarily talking about hyperextending your shoulder like you've dislocated. That's not the same thing. And then we've got extension upward here, okay? Extension going from here back to the returning, and this being hyperextension. Well, flexion is going to be decreasing the angle. We talked about that. So anything forward, upward is going to be flexion of the shoulder. And it's right here, as you see, it says extension going to here, and then hyperextension is beyond that. Okay, so don't get those two confused. You've got your axis of motion when you're going away from your body. You got your abduction out to the side, which is going to be referencing this way. Adduction is toward the midline, and you can go beyond when you're going back to the anatomical position. That's why they show an additional 20, 40 degrees here. Looking downward, we understand that we got the frontal plane, okay? We got AD and we got abduction, but we also have horizontal adduction and horizontal abduction, which is the reference of this axis of motion right here. And it kind of shows you where you can go. Beyond neutral at 0 degrees, you got your zeroed into negative 50. And you got 130 to 160 degrees of motion depending on the person, depending on your structure of your shoulder, your girth, and so forth. A person is bulkier in their pectorals, probably won't have as much motion there, for example. We have internal and external rotation. Once again, we're not really looking at the actual ulnar radius or your forearm, in other words. What we're actually looking at is the rotation right around here in the top portion of the humerus. The actual rotation is this is the axis of motion right here. And so as we're going externally, it's not about what my hand's doing. I actually put my arm at my side, and I can rotate out. And as long as my humerus is externally rotating around this point versus internally rotating, then I actually have that motion based on this being your axis of motion. External rotation, also, if you're going to reference from this point right here, you got external rotation versus internal rotation, okay? So once again, the axis of motion being at the glenohumeral or the ball and socket. Okay, so we talked about all those different motions, and we have to understand the posterior side of the body. Now we talked about superior, inferior, superficial versus deep. Well, deep to the spine or closer to the spine is we actually have your rhomboids right here. And they lie deep to or underneath your trapezius muscles, which is we think about these muscles that go right here. Well, these are the muscles that have a lot to do with the adduction, or excuse me, the downward rotation, bringing it downwards, and also the elevation of the shoulder joint. And so it's really important to understand that these actual shoulder blades, and actually you're going to see some retraction and elevation both, because you see how these fibers run upward. So as those muscles fire off, we know they shorten, the muscles shorten. So that scapula actually gets pulled towards the origin, because remember we talked about insertion is the more mobile end, origin is the less mobile end in terms of origin versus insertion of the muscle. So here's your origin aspect, here's your insertion aspect. So when the muscle contracts, it's going to pull it towards the origin, or the less mobile portion. Your trapezius lies on top of that, okay? You can see the fibers of the trapezius that run upwards, and you can understand how those fibers are real important. You see weightlifters wanting to elevate their scapula and work those trap muscles out. So that's very, very important to see. You can see how they would naturally contract that direction. But these middle fibers here, they're going to aid in upward rotation, but also you're going to be looking at retraction of that scapula right here. You can see how these fibers would pull in. And then the lower trapezius fibers are going to be pulling it downwards. That's why you have depression right here, okay? And it's very important to understand that the trap is not just for shrugging. You know, you have all these different motions based on the direction of those fibers. They go from insertion, and here's your origin all along the spine right here, okay? So these fibers are going to pull the scapula down towards this aspect. So like in the lower portion of, like if you're doing a lat pull down with both arms, the initial movement might be here and then pulling the bar, or a pull up would be another example of that as well.